To the COVID-19 crisis. All weekend, I know state officials and local officials were working hard, not just managing through the different aspects of what we've put into place over the past couple of weeks, but also looking at innovative ideas and bringing some solutions to the real front of the table for us. So again, as we're making these decisions, as we're moving forward, we're being responsive to what those individual needs are, really at the grassroots level. We want to thank them. I was on a phone call this morning with all the different mayors. I was on a call this morning with a lot of different House members, all just giving feedback over the past few days in terms of what they're seeing on the ground, maybe some of the issues that we have to still address. These are unprecedented and times that we're going through, and again, we just want to make sure we're being responsive to those individuals. But today's, we want to announce three pretty significant efforts on a variety of different areas. The first being, I want folks to know that today I'll be informing the federal government and the Department of Education specifically that standardized tests will not take place in New Hampshire this semester. And while remote learning has gotten off to an incredible start, we have to continue to have flexibility in our approach to education. And onerous standardized tests from Washington, I think, definitely send the wrong message to New Hampshire families who are already working incredibly hard to adapt to this new learning environment. The New Hampshire Department of Education will continue to work with the College Board to create access for students wanting to take the SATs this summer or in the early fall. And New Hampshire Department of Education will also work with all New Hampshire schools to develop options to help gauge student performance, and will continue to work with teachers, schools, and families to have access to the assessment materials for remote instruction for all of our students. Secondly, in conjunction with the Federal CARES Act that was recently passed, we are increasing benefits for those on unemployment. Granite Staters currently drawing from the state's unemployment insurance program will, in most instances, be shifted to the federally funded Pandemic Unemployment Assistance Program. And for those on the Pandemic Unemployment Assistance, we're increasing the weekly minimum benefit from $32 a week to $168 a week. And then starting next week, we're adding an additional $600 per week per individual to their weekly benefits, all 100% federally funded. We're extending the length of the time a person can receive benefits by 13 weeks for up to 39 weeks, which again will be federally funded here in New Hampshire. It's important to note that those who are already drawing from unemployment insurance will not need to take any new or additional steps. You should just continue to file as you have been through the state channels. This opportunity is really building on the fact that New Hampshire was able to be one of the first states in the country to offer the expanded unemployment insurance benefits, and the fact that the federal government has come in behind us, enhancing those benefits as well, will create an incredible opportunity for those individuals and families around the state. On those same notes, I just want to always extend a big thanks to Employment Security Commissioner George Kapatis, Assistant Commissioner Richard Lavers. They have really been working around the clock. The fact that the federal bill just passed a few days ago in the CARES Act, and that they've been working to help ensure that these benefits can be accessed immediately, as early as today, and just a real testament to them and their team working with the U.S. Department of Labor and all the folks on the ground here in New Hampshire. I also want to address one final point that also kind of goes to the fact that we started this program so early. New Hampshire had the highest increase in unemployment benefits between the time of March 14th to March 21st, anywhere in the country. But again, it was really because we had opened up our unemployment benefits more aggressively than anywhere else in the country, and the fact that the federal government has come in to not just support but enhance those benefits will provide a lot of opportunity for individuals across New Hampshire. Third, we will be announcing later today that the state will be extending the business tax payment deadline to June 15th for approximately 98% of New Hampshire small businesses, as many continue to adapt to these unfortunate new realities of the COVID-19 crisis. The state will also be extending interest and dividends tax payment deadlines to June 15th for, again, approximately 98% of the interest and dividends taxpayers. As was discussed last week, Congress, as we know, passed and the President signed the CARES Act. But as a result of this bipartisan legislation, we have gone through the bill and we have confirmed New Hampshire will be receiving at least $1.25 billion in COVID-19 relief. It's an unprecedented amount of relief for the state of New Hampshire, but given the unprecedented times and the severe needs from families, education, businesses, individuals, there is going to be a need all the way around. So while this is a large amount of money, it is being allocated and dedicated to a variety of different programs throughout the state. Among the highlights, the federal legislation creates the Paycheck Protection Program, where small businesses can get 100% forgivable loans to cover the salaries and benefits of their employees, mortgage interest, rent, and utilities for up to 8 weeks. Again, a real incredible opportunity for a lot of the small businesses out there. There's also support for the Child Care and Development Block Grant, financial support where funds can go towards our daycare initiative that we announced just last week. So a lot of the subsidies and supplements that we provided in our child care and daycare initiatives, again, are going to now be backed by the federal government, which is very exciting. There'll be additional support to the Substance Abuse and Mental Health Services Administration for mental health and substance use disorders through certified community behavioral clinics. In addition to the $50 million healthcare relief fund that we set up very early on in this process, the federal legislation will provide additional grants to hospitals and nonprofits and other institutional providers to help cover the unreimbursed healthcare costs of this COVID-19 crisis. We've started a plan on how to best operationalize all of these different opportunities, and we'll continue to dig into the details so that we truly can better understand what the state allocation will be, what restrictions the federal government may have placed on them, and again, just how best to use these funds for the citizens of New Hampshire. We will, as always, continue to update the public as we explore more opportunities, and knowing that in working with our congressional delegation, this is the third supplemental enhancement dealing with the COVID-19 crisis. There will likely be a fourth, probably in a month or so is what the hope is. And so any of the holes or the gaps in the system that aren't being covered by the current funds, we always will have another shot to go back and work with our partners in a bipartisan way within the federal government to help, again, provide some of these federal funding opportunities to fill those gaps and respond to the citizens of New Hampshire. And lastly today, we want folks to know that we are requesting today our major disaster declaration for New Hampshire from the federal government, and in doing so, it will allow a variety of opportunities, but one in particular, our National Guard to be fully reimbursed by the federal government should we enact Title 32 status to mobilize our state National Guardsmen and women to help respond to the COVID-19 crisis in a lot of the different staffing realms that they potentially could be called up for. I'm now going to turn it over to Dr. Benjamin Chan, who will come up and give us an update from the Department of Public Health. Dr. Chan.
Great. Thank you very much, Governor, and good afternoon. Let me first start by providing some updates on the numbers in terms of what we're seeing in New Hampshire for testing and diagnoses of COVID-19. So to date, over the last several weeks, there have been more than 5,700 people in New Hampshire tested for COVID-19, and currently we have 314 people who have been diagnosed, confirmed with COVID-19. That's an increase of about 56 individuals from yesterday. So over the weekend, Saturday and Sunday combined, we have had about 100 individuals diagnosed with COVID-19. The majority of these individuals are people with more mild infection who are at home and self-isolating at home. About 45 of these individuals, were about close to 15%, have required some hospitalization during the course of their illness. And unfortunately, 3 individuals have passed away as a result, either directly or indirectly as a result of their infection. All 3 of these individuals were people that were older than 60 years of age and had multiple underlying chronic medical conditions, which is exactly the age group that is most at risk for severe complications from COVID-19. And so our sympathy and our thoughts are with the families that have been dealing with this situation in these difficult times. And I want to also remind everybody that this is exactly the population of residents in our state who we want to protect, especially from COVID-19. And so I think we all have a role in playing to do that. As COVID-19 spreads, both globally as well as within the United States, we can expect to see an increasing number of cases in New Hampshire. You may have heard it said, and I will repeat here, that the United States is in the acceleration phase of the pandemic of COVID-19. And so we are going to hear about increasing numbers of cases in the United States as a whole over the coming several weeks. We will continue to see increasing numbers of cases within New Hampshire. And this is something that we're obviously actively monitoring, but we're not just sitting back and watching the numbers. We're actively out investigating people diagnosed with COVID-19 to identify potential susceptible contacts who we reach out to and recommend either go on quarantine if they are without symptoms, meaning stay at home, even with a lack of symptoms, or if they are symptomatic, have recommendations for staying at home, potentially testing for those that are at higher risk of potentially transmitting COVID-19 within our communities. We've gotten a lot of questions over the last several weeks about where this virus is it spreading in their individual communities. We're seeing an increasing number of people being diagnosed that have no specific risk factors identified, meaning they may not be identified contacts of other people with COVID-19, may not have traveled, and so we believe there are increasing numbers of people with community-based transmission of COVID-19. And so I think one of the key messages now is that this virus is out in our communities, it is circulating, and so everybody needs to take steps and precautions against not only getting infected themselves, but also spreading infection to other people within our community, certainly those who are most vulnerable. I want to make quick mention that there is, as I've mentioned before, there's increasing evidence that people can spread this virus before they may have symptoms, what we call pre-symptomatic transmission. There have been a couple of studies that have come out in the last couple of weeks looking at different populations like the Diamond Princess cruise ship and certain long-term care facility populations, for example, in Washington State. And what some of these newer studies have shown us is that of the people that have tested positive in these organizations, a large percentage of people, potentially up to half or more, have potentially shown tested positive for this virus in the days before they showed symptoms. And I say this to highlight a point that it's not just people that are symptomatic in our communities that need to take steps to stay home to prevent transmission within our communities. This is the reason for the recommendations around social distancing in general. And so everybody in our communities need to take steps to prevent exposing and passing on this virus to other people within our communities. So if people don't need to go out urgently, please stay at home. If people are out, for example, at a grocery store or needing to go into the hospital, for example, social distancing recommends maintaining at least 6 feet of distance between oneself and another person. So we ask that everybody in our communities, whether they're even if they're not having any symptoms and otherwise feeling well, to please abide by these recommendations for staying home if going out is not necessary, and for maintaining at least 6 feet of distance between people when out in the community, for example, at a grocery store. That includes waiting in lines, or other, even walking outside. Please try and maintain social distance between other people. I want to also particularly mention that those who are 60 years of age and older, or people with chronic medical conditions, as I've already mentioned, are at increased risk for complications of COVID-19 and potentially requiring hospitalization, potentially even dying from this infection. And so those individuals especially, we recommend try and more strictly stay at home. Those individuals need to have a 30-day supply of needed medications at their homes, maintain a supply of food and groceries, and I think all of us in our communities need to try and protect those more vulnerable groups by, unfortunately, avoiding close contact with people that may be more susceptible to serious infection that could cause a loved one to end up in the hospital. So we are continuing to monitor and track the situation. There have been requests for more information, potentially at the community level. We are going to be releasing more information on our website in the next day or so, including maps looking at the number of cases at the town level. We have heard the request and the need for more information, not only from the public, but from local healthcare and public health partners. So we will be releasing more information on this in the next day or so. But I want to stress again that even if you live in a town where a map may not show that COVID-19 has been found to be circulating, that we would encourage people to operate under the assumption that COVID-19 is circulating in your communities, even if there has not been somebody officially diagnosed, and to take the appropriate precautions to maintain social distancing, to stay at home if it's not necessary to go out, in order to not only protect your own family and friends, but people that may be more vulnerable in your communities, including older parents, grandparents, neighbors that may be of an older age, or certainly people living in long-term care or assisted living facilities. So thank you very much.